Good morning, team. My name is Larissa, and I'm the registered nurse for the care team today on the medical surgical unit. At the start of this shift, I'm responsible for prioritizing patient care, performing comprehensive assessments, coordinating the plan of care, and delegating tasks appropriately to the LPN and the UAP. Accordingly to Giddens, registered nurses are accountable for clinical judgment, prioritization, delegation, and evaluation of patient outcomes. Effective delegation requires consideration of patient acuity, staff competency, and scope of practice, which is also supported by Yoder Wise and Sportsman. Today, our team is caring for three patients, and I'll prioritize them with the following order. My first priority patient is patient number one, a 25-year-old newly admitted patient with nephrolithiasis and elevated temperature and abnormal labs values. My second priority is patient number two, a 21-year-old who's post-op day one following an appendectomy and is currently stable. And the third patient is patient number three, a 30-year-old post-mastectomy patient who is preparing for discharge and has questions regarding wound and drain care. I'm prioritizing patient number one first because this patient is a new admission with abnormal labs and elevated temperature, which raises concern for infection according to Giddens. Patients with potential threats related to infection or physiological instabilities require an immediate access by the RN. So patient number two is stable on post-op day one with no active bleedings. That's why is my second priority. And patient number three is a medical stable preparing for discharge. While education is essential, it does not take priority over the patients with acute changes. When I enter patients' one room, the first thing I would do is perform a focus and a comprehensive assessment on my patient. This is going to include vital signs, assessing pain, urinary output, reviewing labs results, and evaluating for signs of infections, and as well checking for IV access. I will also review providers' orders and determine if additional interventions such as cultures, IV fluids, antibiotics are needed, and I will follow the provider of any concerning findings. Andrea is the LPN today. For patient two, I'm going to need you to delegate routine post-op care. This is going to include obtaining vital signs, monitoring the surgical dressing, assessing pain levels, and as well giving oral or IM medications within your scope of practice, and encourage use of sensitive spirometer, assisting with ambulation and documentation and documenting your findings. For patient three, I'm going to need you to complete the final discharge teaching. After I do the initial teaching for the patient, you may reinforce education related to drain care, signs of infections report, and active restrictions. For patient one, you may assist me with collecting vital signs or giving medications, only if I need to. So I will retain the responsibility to continue the assessments, interpretation of labs, and care planning.
Thank you, Larissa. My name is Andrea. I am the licensed practical nurse on the care team today. As an LPM, I do practice under the direction of the registered nurse. According to the Florida Statute 464.003, the practice of a practical nurse includes performing selected patient care activities such as administering treatments and medications, promoting wellness, and reinforcing health education under the appropriate supervision. I am accountable for decisions based on my education and experience. However, per Crawford, I cannot independently perform comprehensive assessments on unstable patients, interpret clinical data, require nursing judgment, formulate nursing diagnoses, or initiate or modify the plan of care. Based on today's delegation, my priority patient is patient two, the 21-year-old who is post-operative day one following an appendectomy and is currently stable. Because this patient is stable, I can safely perform routine post-operative care, including obtaining and trending vital signs, monitoring the surgical dressing, assessing pain levels, administering ordered oral or IM medications within my scope, encouraging the use of incentive spirometer use, assisting with ambulation, and documenting the findings. If I observe any concerning changes, such as increased pain, fever, abnormal vital signs, excessive drainage, or signs of infection, I will promptly report these findings to you, the RN, for further assessment and intervention. For patient 3, the post-mastectomy patient preparing for discharge, I will reinforce education after you have completed the initial teaching. This includes reviewing drain care, signs and symptoms of infection to report, and activity restrictions. I will notify you if the patient has ongoing questions or concerns. For patient 1, I understand that the initial assessment and clinical decision-making remain with your scope, and I will assist with collecting vital signs or administering medications within my scope if you delegate it. And I will report any findings, abnormal findings immediately. Throughout the shift, I will communicate clearly with you, the RN, and collaborate with Cynthia, the UAP. According to Yoder Wise and Sportsman, effective delegation requires open communication between the delegator and the delegatee to ensure patient safety and appropriate use of scope of practice.
Cynthia, as you are the UAP today for patient 1, I would like you to obtain a full set of vital signs for me and assist with monitoring intake and output. Please report any abnormal findings to me immediately. For patient 2, I'm going to need you to please assist with ambulation hygiene and repositioning the patient. And for patient 3, please assist me with basic comfort measures, help me ensure belongings are prepared for discharge, and please notify me if patient needs any additional teaching.
Hello, my name is Cynthia and I am the UAP for the team today. My priority for patient 1, the 28-year-old new admission with nephrolithiasis, elevated temperature, and abnormal labs. This is my priority patient because an elevated temperature may indicate infection, and as the UAP, I can assist with early identification of changes in condition by performing frequent vital signs, monitoring intake and output, and reporting abnormalities promptly to the RN. According to the leading and managing in nursing, the RN may delegate routine non-invasive tasks to the UAP, while the RN retains responsibility assessments, interpretation of data, and clinical judgment by Yoder Wise and Sportsman. For patient 1, my delegated responsibilities includes obtaining vital signs, toileting, encouraging fluid intake, measuring urine output, straining urine for stones if requested, and reporting findings such as fever, decreased urine output, or increased pain to the RN immediately. I understand that I cannot assess abnormal lab values, administer meds, or provide patient education, as these tasks are outside my scope of practice. For patient 2, the 21-year-old with this post-appendectomy, day 1 who is stable, I can assist with ambulation, positioning, hygiene, and vital signs. I will observe the dressing for visible drainage and will not remove or change it. I would go report any abnormalities. For patient 3, the 34-year-old mastectomy patient ready for discharge, I understand that patient education and drain care teaching must be completed by the RN or LPN. My role is limited to comfort measures, mobility, and notifying the RN. The Florida Board of Nursing states that UAPs may perform delegated tasks that do not require nursing judgment and must always work under the RN supervision. Florida Board of Nursing. I will communicate all findings promptly and accurately to the RN to ensure patient safety and continuity of care.
Thank you, everyone. So throughout this shift, we will maintain an open communication and collaborate closely. Any change in patient condition or safety concerns should be reported immediately so I can reassess and modify and plan the care as needed. This delegation plan is aligned with an evidence-based leadership and delegation principles. According to Giddens, emphasize matching patients' acuity with a proper level of nursing judgment. This delegation plan is supported by evidence-based practice. Crever Core in all emphasize that safe delegation depends on patient acuity, clarity of communication, understanding the delegatee's role, and on ongoing RN supervision. The study highlights that inappropriate delegation of lack of role clarity can negatively impact patient safety and the competency and the scope of practice for everyone. By prioritizing patient care on patient acuity and delegating tasks appropriately, we can all maintain patient safety. So thank you so much, and that's it.